How vile, how intrusive, how deeply unprofessional can you get? I feel like we're living in a time where people value clout and social media validation over their professional careers. Consent matters, and no patient gave their consent for their bodily fluids to end up on TikTok as part of a viral slideshow. Hey loves, so when I think social media drama can't get any worse, something else comes along to shock me. This time, it's a viral TikTok controversy involving healthcare workers from a California facility, the Sansum clinic, who were caught posing with bodily fluids left behind by their patients after a sensitive exam. Now, let's pause for a moment. How vile, how intrusive, how deeply unprofessional can you get? This wasn't a joke gone wrong. This was a massive breach of trust and a complete violation of professional ethics. Take a look. Let's just take a look at those pictures in more detail. So on the first image, it says, "Are patients allowed to leave you gifts?" At this point, when I saw this, I thought, okay, where is this going? What kind of gifts are they talking about? And the next picture says, "And we love them so much." This is clearly after an exam. They're taking pictures once these women have left the facility. It's just disgusting. And here's another one. She's got thumbs up, smiling, smirking with a yes and a love heart. Another pose saying all shapes and sizes. Here the mark is even bigger. And the final picture says, "Make sure to leave your healthcare workers sweet gifts like this." Right, to give you some context, this clinic carries out pap test, what we call in the UK as cervical smear test. These are already invasive and uncomfortable procedures, and they take a lot of bravery for women to even attend. And instead of respecting their patients' dignity, these healthcare workers decided to exploit it for likes and views on TikTok. Like, be for real. Speaking personally, I remember how anxious and nervous I was about my first smear test. I was anxious because I didn't know what to expect, and it really took my mom encouraging me, talking me through what I can expect, that got me through. And I know I'm not alone in that. I know that so many women feel this way, and this is why stories like this is so damaging. We already know that the uptake of cervical screenings or pap test is dropping. In fact, a Guardian report in the UK found that 42% of women avoided smear tests because of pain, 40% feared that it will be performed by a man, and 19% cite sheer embarrassment. Now imagine those women seeing this TikTok. It only encourages their fears and discourages them from going to these life-saving exams. At the very least, women deserve to be treated with dignity and respect. They should not have to worry that their private medical moments could become a viral meme. This isn't about one bad TikTok. This is about social media accountability, online professionalism, and how one careless act can harm trust in the entire healthcare system. And I think for me, this has to be the worst picture because you've got, how many people in there? 1, 2, 3, 4, 5, 6, 7. 7 people in there posing on a table just after a patient has left, taking pictures and finding this hilarious. I'm just thinking, how did they get to this point? After the exam, did they call each other, come in the room, let's take a picture? Did they find this amusing? Ugh, the thought of it is just making me sick.
Kathy, come here, hurry. She left her paper in here. She left her paper. Get everybody together. We're going to judge this one. What are we thinking? This one's got to be like at least a solid 7. That's a good one right there. Good job. What do you guys think? Did anybody else take papers from the patient's room? Anybody else? No? Everybody line up. I want everybody to hold this, and then we're going to all... Now, someone get ready and go put this in the hallway. Actually, put this one in my office. I'm going to have this one framed. I really like this one. Y'all did a good job on this one. I really love this one right here. Good job. I am so proud of y'all. I am just so happy with all of this. This is fantastic. Yes, she did a great job. Go, Kylie, go.
Honestly, guys, what shocks me the most isn't the act itself. It's the fact that a whole group of healthcare professionals felt that this was okay. They thought it was funny. They were literally taking pictures with patients' bodily fluid, and not one of them stopped at any moment to say, hold on a minute, this is wrong. This is a violation of trust. And here's the thing, you don't need to have sat through medical ethics lectures to know that this is wrong.
Saw this thing going around TikTok today and yesterday about these healthcare workers in California who are posing with pictures of bodily fluids that patients left on their table after getting up from an exam, which is it's just like the most vile form of human, right? I'm going to demonstrate how we treat patients with kindness and compassion in radiology, because let me tell you this, sometimes patients are leaking fluids from them when I do a CAT scan. So I'm going to demonstrate how to get a patient off the table without making them feel embarrassed. Here we go. So I'm a patient and I'm getting up off of this pad and there's something left behind. Let me demonstrate what I'm going to do behind you. And as you turn to sit in the wheelchair, simultaneously, I'm going to be standing right here. And while my patient's getting into their wheelchair, I'm gathering this up and I'm throwing it away so that they never have to see the mess that they left. Take my gloves off. What those people did in California, posting those pictures with patients' mess on the table, is just horrific. And I just want you to know that there's still people in healthcare who are going to treat you with kindness and compassion and never make you feel embarrassed for normal bodily functions. Thanks for coming to my TED Talk.
Some things are just basic human decency, but instead, every single person in that room went along with it. Then to take it even further and post it to the public. That's not just unprofessional, it's reckless. It reminds me of some of the stories I've covered here on this platform. I mean, my last one where I was talking about a teacher who was dressing inappropriately, or that nurse live streaming on TikTok while treating patients. In both cases, I said the same thing and I'll say it now. I feel like we're living in a time where people value clout and social media validation over their professional careers. The chase for likes, views, and going viral is clouding their judgment. Let's take some comments. The first commenter says, just reminds me why I've gone over 10 years without this service. Wow. That's a long time. That's worrying. And I'm going to address that because that's just wrong. You guys are so dramatic. Was this unprofessional? Absolutely. But they're not putting any names or faces of patients. Y'all need real problems in life. Someone else said, never had it myself and glad I didn't, especially after seeing this. Ooh, another worrying post. Another person says, I always had my fears on who I could trust, but this confirmed those fears. Sadly, I'll probably never get one ever. I'm a virgin, so that adds another layer of fear. Someone else says, this is the video everyone is so upset about. I don't see it as them making fun of anyone. Okay, that will get addressed too. What really upset me about this whole situation is actually reading comments like the ones we've just seen where women are saying, I'm just not going to go for a smear test. And to me, that's really sad and it's worrying. So I want to pause here and speak to people who feel that way. Please don't let the actions of a small, unprofessional minority of healthcare workers stop you from protecting your health. What they did was vile and unethical, but it doesn't define the health profession as a whole. Your cervical screening is too important. That one checkup could be the difference between catching cervical cancer early when it's treatable and finding it too late. It could be the difference. I've seen what this cancer can do to people if it's not picked up early. The pain, the impact on you, the impact on your family, impact on your loved ones. It's just not worth it. Go for that checkup. Yes, the procedure can be invasive. Yes, the first one is daunting, but I can guarantee you, once you go through the first one, you realize there's actually no big deal to it. There really isn't. Honestly, after having kids, I really don't feel embarrassed about it. It's just a body part There's no big deal. It's a natural process. Nothing to be embarrassed about. Nothing to be ashamed of.
Your smear test in under 1 minute. This is a speculum. We add a lubricant to make it easier to insert, and we use it to hold open the walls of the vagina so we can see the cervix. It comes in several sizes for your comfort or to suit your anatomy. When the speculum is opened, you can sometimes feel a slight stretch. This is the part some women find uncomfortable. Don't worry, this is not usually painful, and it only needs to be open a little and not all the way. Once it's in position, we gently stabilize it to get a clear view of the cervix, and there it is at the top of the vagina. And while we're at it, we also don't care if your legs are hairy or what type of haircut you have down there. We're just looking out for the cervix. Next, we use this soft brush to collect some of the cells. It's just a few quick turns and then we're done. The cells then go into this liquid and are sent off to the lab for analysis. The speculum is closed, gently removed, and that's it. You've just had your smear test.
About those fluids on the chair, let's be real. It's probably the lubricant gel that they put during the procedure. Even if it isn't, it's nature. No big deal. Nothing to be ashamed of. If there's just one thing you want to take from this video, go to your smear test. Get your checkup. You are too precious. Your health matters too much. Don't let embarrassment or fear become a barrier to life-saving treatment. And then there were other comments. The one saying, what's the big deal? They didn't show anyone's faces. No names were shown. Let's pause right there. Because the issue isn't whether a patient's identity was revealed. When a patient comes in for a medical procedure, they trust that anything left behind, whether fluid, waste, or anything else, will be disposed of respectfully, in private. What they do not expect is for it to end up on TikTok as a punchline. Consent matters, and no patient gave their consent for their bodily fluids to end up on TikTok as part of a viral slideshow. So whether names and faces were shown or not is completely irrelevant. The expectation is dignity, the expectation is confidentiality, and the expectation is professionalism. And here's what's even more worrying. If these healthcare workers are so relaxed and casual about posting such inappropriate posts online, what else are they doing? Are they gossiping about patients behind closed doors? Are they careless about private information in other areas too? Because once you show this level of disregard in public, it seriously raises red flags about how you operate in private. And that's why this is not no big deal. This is a huge deal because it speaks to the wider issue of trust in the healthcare system. Now, once this whole situation went viral, Sansum Clinic issued a public statement. Let's take a look. The first statement they released says, we share the concern raised by a recent social media post at one of our care sites and took immediate action once we became aware. We take this matter very seriously and are conducting a full review. Patient trust and dignity are always our top priority, and any behavior that violates those standards is unacceptable. The individual who posted the content is a former employee and was not employed with us at the time of the post. Any other staff shown are part of our internal investigation and on administrative leave pending the results. So that was the first public statement that they released. Shortly after, they released another statement where they said Sutter Health has terminated the employees responsible for the inappropriate and insensitive photos posted on social media. This unacceptable behavior is an outright violation of our policies, shows a lack of respect for our patients, and will not be tolerated. Rightly so. Protecting the trust of those who serve is our highest priority, and when that trust is violated, we take swift action to address it. We expect all team members to live our patients' first mission and uphold the highest standards of compassion, professionalism, and respect. We are using this inappropriate incident to reinforce our comprehensive policies with all our team members across the organization as part of our commitment to providing all patients with high quality, compassionate care. As you've seen, they've confirmed that those employees involved in that inappropriate, insensitive post, they've been terminated. And to me, it sends a clear message that there is just no room for this kind of behavior in our healthcare system. Patient trust and dignity has to come first, always. But I'd like to hear from you. Do you think the clinic handled this the right way? Do you believe posting patients' bodily fluids online is ever excusable? Or do you think it's no big deal? Drop your comments below. I'm really curious to see where you stand on this. Please don't forget to like, comment, share, and subscribe. Till next time, guys. Bye.